Welcome back to the Morning Blend. Don't live with constant pain, whether it's in your neck or your back. Get the help you need today to live life fully. Here with the details, Dr. Devin Luzad of Spinal Care of Nevada. Great having you back, buddy.
Living life fully, which basically means stop suffering, don't have pain. You know, if you ask people, what does it mean to be healthy? Most people say to feel good, and that's the #1 reason people seek our help is they have an ache, they have a pain, neck pain, back pain. And we use a very gentle, different type of chiropractic. It's called the Nucca Method. By now, you may have heard of it. We've been in the city for almost 15 years, and it's not the twisting, cracking, popping type of. It's not aggressive. It's called a low-force technique. So it's just a very gentle type of chiropractic that gets pressure off the nerves and can help with things like numbness, burning in the body, tingling in the hands like carpal tunnel, tingling down the legs, sciatica, but you know, more importantly, you being a pain in the neck could be a pain in the neck for other people. So,
yes, no, that I know.
It's not uncommon to have loving wives deliver their husbands to our office.
Say, please do something with this.
Just help me.
Let's talk about how you pinpoint the location of the pain, because really, even though you might be feeling pain in the arm, that might not be where the trouble spot is.
How did you know that? Have I said that to you before?
You've been on a couple times.
Think about this, okay? Pain in your hands, numbness, burning, tingling in your hands. A lot of times a surgeon will cut on that, but as this diagram shows, the nerve runs into your neck, so that same nerve can control breathing, asthma, high blood pressure, which there's research saying the adjustment we do can even help lower high blood pressure equal to 2 medications.
Wow.
In the lower back, those nerves run to the intestinal tract, bowel problems, digestive problems, male-female disorders. Listen, I don't claim to cure that. I just help the nerves in the back and the neck, and a lot of times help with pain, numbness, and tingling, but those same nerves shoot up into the head. They control sinuses, control neck pain, migraine, headaches, which is, you know, you sometimes are blinding, dizziness, balance. The nerves in the neck control how you relate to the world. So if you know someone, possibly your mother, father, grandparents, who have balance disorders, dizziness, vertigo, you know, again, all we do is just get a little bit of pressure off so the body can run itself, and we do that with a gentle chiropractic technique. The Nucca Method is no cracking, no popping, just a real subtle touch.
There are people that have been living with chronic pain for years and years, to the point where they forget what it's like to live without said pain.
You start to believe that you have to learn to live with it because the doctors told you, hey, guess what? I can't help you. You have to live with it. We have found that there can be hope for just about any painful health problem on the planet. So here's how we get to the root causes. We do a 2-day workup. This is not chiropractic where you walk in and get popped. This is chiropractic where we're going to spend a good hour to 2 hours on the first visit, exam, consultation, thorough history, x-rays that are taken at different angles and have probably ever been taken of your spine before. I'm then going to spend almost 2 hours studying all that information. We send the patient home, schedule another hour the next day, and listen, if that's a lot of time for you, there's probably a better method for you. We're just going to take our time and do this the right way. Day 2, you come back usually with your family, because if I can't help you, we're going to direct you to the right specialist. If we can, we're going to teach your family how to support you through the process. But if you've had neck pain for years, back pain, pinched nerve into the legs, arms, hands, or even up into the head, the Nucca Method, there may be hope for you.
No question. And I know that you also use low-level laser therapy to promote healing as well.
It's an FDA-cleared procedure that helps circulation to the damaged joints. So while we fix the spine and necks and backs, we can use this laser into a bad shoulder, into a bad knee, a bad hip, bad ankle. You know, the finer joints that sometimes people just have to go get operated on. If we can get more circulation to a bad area, listen, we can either prolong when the operation occurs, reduce the pain, maybe there's a chance you never have to get cut on.
And with that laser, it's essentially kind of rallying the troops, your blood, saying, hey, you
know,
attack this part.
That's perfect. You know, the adjustment focuses on the neck. We're going to get your head on straight, or your spouse's head on straight. The body can balance underneath that. That's why the Nucca Method gets results where a lot of other procedures have failed. Even people who've been through spinal surgery, fusion, you know, Home Depot put in their body, the laser rallies the troops and gets all the necessary mechanisms of your blood, your oxygen to the damaged area, reduce inflammation, help you feel better. That's step one. Step two is let's correct it so it doesn't keep coming back over and over again.
Which is very important. Now, how can we get more information on this technology and get in on this?
The 2-day workup, we reserve 20 slots for people to get the $180 workup for $37. We really do count who calls in. So the first 20 callers to the number you see on the screen, it'll only be $37. That's my gift to you to see if we can help.
Awesome. And this isn't one of those infomercials that airs 15 more times in the next day.
One and done.
No,
you got 20 people.
20
and
from this second.
Or you can pay full price. That's okay too.
Yeah, you know, if you're a baller like that. Devin, great seeing you as always. Thank you so much. Good seeing you. Great special offer Dr. Devin has. The first 20 callers from right now get a consult, exam, and x-rays for only $37. It's normally $180, and it's not a fly-by-night thing. It's a couple hours. This is rather not valid for Medicare age patients due to federal guidelines. For more information, just head to the website or call the number listed on your screen. Dr. Devin, good guy.